Hello everyone. I am Dr. 𝖁𝖓𝖎. I am a cardiology fellow at King Faisal Research Center. I am part of the social media team of CTI, and today we have another interview with two fellows from United States. Dr. 𝖓𝖓𝖓𝖎. He is a cardiology fellow from University of Toledo, and Dr. 𝖓𝖓𝖓𝖎 is the principal from University of North Dakota. Welcome, Dr. 𝖓𝖓𝖓𝖎 and Dr. 𝖓𝖓𝖓𝖓𝖎. First of all, we want to hear from you just introduction about your paper, which is early versus late discharge, both bicuspid or both transcatheter aortic valve replacement readmission for permanent pacemaker. Go ahead.
All right. So as we all know, conduction disturbances after TAVR is one of a common complication of TAVR. They can range from bundle branch block to high-grade AV block, which sometimes can result into pacemaker implantation in about 6 to 25% of the patients. So the question we wanted to answer is, if the patient is discharged early, are they at higher risk for readmission for pacemaker? Over the past 2 years, especially with COVID pandemic, there's been more interest in early discharge. It saves patient money and also decreases the risk of infection and contamination from COVID. So this was a little bit of introduction, and for that our study was from the National Readmission Database. The National Readmission Database is actually the largest publicly available all-payer inpatient healthcare readmission in the United States. We did analysis from 2016 to 2018. Each year, we have records of 35 million discharges. And we did only the hospitalization associated with TAVR admissions between January 2016 2018. The NRD uses ICD codes to capture diagnoses and also procedures. However, we know that the ICD codes for procedures are very specific, which actually adds a lot of strength to the study. So we divided our cohort into two separate groups. Those who are discharged early, which means discharge on day 0 or day 1, and those who are discharged after that, starting from day 2 and beyond. First, we excluded some patients, patients who are aged less than 18, the young personnel. We also excluded patients who did not go to TAVR on day 0. If the patient went to TAVR after day 0, they were excluded. And those who underwent transapical TAVR, and those who had third-degree AV block, or those who had pacemaker implantation at the time of the admission, or if they had it before admission. After we did the exclusion and inclusion criteria, we came up with 68,482 hospitalization associated with TAVR in our cohort. There was about 29.6% discharged early, and 70.4% were discharged late. The early discharge group was found to be comparatively younger than the late discharge group. They were less likely to be women and more likely to be present in an elective admission. So over the study period, we found the rate of 90-day readmission for pacemaker implantation stable, around 1.8% in 2016 to 2.0% in 2018, with a P trend of 0.32. However, the early discharge after TAVR has increased from 2016. It was 16.2%. It rose to 37.9% in 2018, which represents an increase in TAVR early discharges, and yet we have stable pacemaker implantation within 90 days of discharge. Our study also discovered the independent predictors of readmission for pacemaker implantation. Some of them were related to the AV block, the first degree AV block and second degree AV block, and others were related to chronic comorbidities such as chronic heart failure, diabetes mellitus, and renal failure. We also did additional analysis. We did subgroup analysis on admission on 60 days readmission. We did also on 30 days readmission. We did on elective. Elective admission. We did not find any difference between early group and late group in terms of readmission for pacemaker implantation. We also did sensitivity analysis to determine if there's another discharge day that can be used as a cutoff point, and yet we find that the discharge rates were similar. We didn't find any difference between early and late discharges. Our secondary outcomes here is to determine if there is any difference between time from discharge to readmission for pacemaker implantation, and that also is not different between the early discharge group and late discharge group. The median was 5 in both groups. The most interesting finding, and I think it relates to the less length of stay, is the mean total hospitalization cost. It was about $5,000 difference per each patient in the early discharge group. So in our conclusion, we demonstrate that early discharge after TAVR has increased over time, and yet there is no change in the readmission or the time to readmission for pacemaker implantation. And this study is retrospective, and we will call for studies that are prospective studies to study if there is any benefit from early discharge, or if there is any risk of early discharge versus late discharge.
Excellent. Thank you.
Thank you.
Dr. Elzanaty, do you want to add anything?
So I just want to add that our study comes in conjunction with many studies that actually was published recently talking about the same topic. So our study adds to the body of evidence that early discharge is actually safe and feasible. Very recently in Cleveland Clinic, they published a retrospective analysis looking into patient-level specific data about early or same-day discharge by, I believe it's 𝖁𝖓𝖓𝖎 et al. And they find exactly the same, that there's no change in conduction, abnormalities requiring pacemaker in early discharge, provided that careful selection of patients is there. So I think we're heading toward that direction. I think it would be feasible, but definitely we still need more large randomized trial to better characterize those at high risk of having such problems. So I think definitely we are heading there, particularly with the COVID was the final straw, I would say, that pushed people to look more into it. But yeah.
Yeah, excellent. So I just have one question regarding what is the definition of early discharge? Usually post TAVR, if you said early discharge, is it 1 day, 2 days, 1 week, or?
Correct. So we defined early discharge or discharge at the same day, which is day 0, the day of the same procedure, or next day. So will be a total of less than 2 days or less than 48 hours. If they stayed 2 or more days, like beyond the day of the procedure, then it's going to be late discharge. So by early, it's day 0 and day 1.
And any one of the patients with like any patients who admitted again with need a pacemaker, they have underlying pre-TAVR ACD abnormalities or any underlying reason?
Conduction. So in our exclusion criteria, we did exclude those who did have severe conduction abnormalities requiring pacemaker of any sort. So pacemaker or CRT or any intervention, either in the past prior to the TAVR or during the index admission. So we excluded them. We did, however, include those who had conduction abnormalities like bundle branch blocks, fascicular blocks, or first or second degree blocks that did not require any pacemaker. However, it's one of our big limitations of our study that we cannot really tell if those conduction abnormalities are there before the TAVR, before the index procedure, or if it happened after that. But in a sense, it's also like a strength, because we know that even if you have those conduction abnormalities before or after, you're still, the risk of readmission for pacemaker is still not changed, so to speak. So yeah, I hope that answered the question.
And what about the readmission reason? Is it only conduction abnormality, or there is another other causes, and one of them is conduction, or only purely conduction?
So we, in our design for the study, we looked specifically for the readmission for pacemaker implantation, like a significant conduction abnormality for pacemaker. So we did not explore other readmission causes in our study. However, there was multiple studies that looked into that, and I would say the top reason was that. But in our study, we did not actually investigate those findings. So we looked into 90 and 60 and 30 days readmission rates, but only for significant conduction abnormalities requiring pacemaker or CRT.
Yeah. Okay, Dr. 𝖁𝖓𝖓, do you want to add or say anything?
Yeah, I was just saying that this was the question that we were trying to answer. We were just trying to answer if the early discharge is linked to increase of pacemaker readmission. We didn't look at other outcomes. Regarding the previous question about the other conduction abnormality, in fact, the first degree and second degree was one of the predictors of earlier admission for pacemaker implantation. So yes, if this answers your question, if those who were readmitted for pacemaker had underlying abnormality, yes, they had. Some of them had underlying abnormality, and they were associated with increased risk of pacemaker implantation and readmission.
Yeah, great effort. Congrats, both of you. What is the future direction of this paper?
I would say this paper adds to the body of evidence that it's safe and reasonable to consider same-day or early discharge. But as I mentioned earlier, we need larger multi-center trials that can quantify or provide risk scores that can enable us to safely decide if this patient is safe to be discharged or not, particularly if they have underlying conduction abnormalities. That's not an class 1 indication for a device. So I would say this opened the roads to this, and definitely we need more data about risk stratifying patients on a patient level, on an individual level, on early discharge versus late.
Dr. 𝖁𝖓𝖓, last comment.
I'm sorry, I can't hear you well.
Dr. Dr. Maraey, do you want to add?
No, I agree with Dr. Elzanaty about the conclusion. I think we need more data, more trials to also to prove if the early discharge is safe as well, and that's what we are looking for.